Hi, my name is Kirk Hamilton. I'm a practicing physician assistant of 30 years in nutrition, prevention, and integrated medicine, author and health educator, and host of this show, the Staying Healthy Today show. Today's show topic is dementia. Could it be statin induced? Statins are the most prescribed drugs in the world, and they help lower cholesterol. I was recently listening to a lecture by a very well-known integrative medicine cardiologist, Dr. Stephen Sinatra, who has concerns about statin drugs and the ability to block cholesterol. Maybe there's some side effects. And he gave a case study of, he went back to a reunion, and one of his classmates had Parkinson's disease, and it didn't present quite as the way Dr. Sinatra should. So he asked him, are you taking any medications? He's on a statin drug. He said, and it came about, the illness, the same time that they started it. So anyway, make a long story short, he got off the statin drug, took coenzyme Q10, which it blocks, and coenzyme Q10 helps produce energy within the mitochondria, which is the little powerhouse energy producer in the cell. And the person called him back several months later and said, I don't have Parkinson's, it's a miracle. Which brings on the discussion. If you do a PubMed search, which is a Natural Library of Medicine, for cognitive dysfunction and statin drugs, generally they'll say that statin drugs in the studies help reduce the risk of dementia, with scattered case studies of possibly someone had some mental dysfunction taking a statin drug. Recently, I had a patient who was being evaluated for dementia. The wife's taking care of him, and his cognitive function has declined to where now he might have to be in assisted living. And so we evaluated him, and here's some things we found out. Number one is his cholesterol was 104, and he'd been put on a statin drug by his cardiologist because he'd had prior heart disease. 104 is below anybody's normal. The normal in the United States is between 125 and 200. Most people are over that, actually. And in rural China, when they had no heart disease and they ate strict plant-based diets, I mean, the cholesterols were 129. So that's way low. And unless you're trying to do it, the only other sudden drop is if you have a liver problem or you might have a cancer. So in this gentleman's case, it was 104. Took a CoQ10 level. I do vitamin mineral panels on almost all my elderly patients. Did a CoQ10 level, and his CoQ10 level is very deficient. So why is that significant? Statin drugs block the production of cholesterol. They also block the production of coenzyme Q10. Coenzyme Q10 helps move electrons or electron transport to produce energy in the cell, every cell, heart cell, brain cell, and also it helps protect the mitochondria because it has an antioxidant side of it to damage. So we need coenzyme Q10, and we have to have cholesterol for the production of hormones, and also it's part of our brain. So in just that, there's a reason to be suspicious that the statin drug might have lowered the cholesterol too much. But let's go on with that patient. That patient also had, remember, cholesterol is kind of the mother hormone. All your other hormones are made from that. Pregnenalone, very low in this patient. That's associated with chronic pain and also memory. DHEA, again, associated with longevity, just in general. And then testosterone. Testosterone, aside from what everybody focuses on as the libido part and the sexual part, it's very important for brain function, help with depression, anxiety, and boost people's mood up. That was low. And that could be from blocking the production of cholesterol, and i.e. hormones, and aging. So there's another risk factor for cognitive dysfunction. Then we looked at some vitamins. Vitamin B1, very low, important in carbohydrate metabolism. I have a neurologist I've interviewed from Italy in 4 or 5 different very serious illnesses. Multiple sclerosis, stroke, chronic fatigue syndrome, fibromyalgia. Higher levels of B1 improve energy production, mood, mind, and behavior. This gentleman also had low levels of vitamin E. Vitamin E protects fat-soluble areas in the body, i.e. the brain and neurons. And then vitamin D was low normal. It wasn't absolutely deficient, but low normal. So now we have compounding things that might have affected the lower cholesterol being affecting mentation in the first place, which might have come from taking the statin drug, which is the point of this. This person also had elevated homocysteine, a toxic amino acid that can affect, when it's too high, that means you might be deficient in B12 folic acid and B6, and also some other nutrients. Increases the risk for vascular disease. He had high blood sugar. His average blood sugar was in the pre-diabetic range. Hemoglobin A1C was just a little bit elevated. So this person, it's high blood sugar and diabetes is sometimes, well, Alzheimer's is thought of as sometimes the type 3 diabetes. So we have all these risk factors in addition to that person's cholesterol being lowered to a very low amount. So the moral of this story is severalfold. One is, if you have a loved one or somebody with dementia or sliding cognitive decline, check their medications. They can have polypharmacy affect their mood, i.e. check if they're on a statin drug. Check their cholesterol to see if it's definitely below 130. 150 is where you can start reversing heart disease. So that's pretty low, 104. If you're with a progressive physician, though these tests can be done on any Medicare patient, the vitamin panels I'm talking to you about and the hormone levels, those should be assessed, certain vitamins and certain hormones, and blood sugar. So my name is Kirk Hamilton. There'll be a little summary of what I just said in the description below this YouTube. Sign up for my newsletter. I'll see you soon. You have a fabulous day.